Thank you so much, Dirk. And let me just say good afternoon to everyone listening to us today. As Dirk said, I'm Congresswoman Joyce Beatty. And today, we come together on this call on the horizon of hope. We are right here live at the Celeste Center with the CPH and the Ohio State Wexner Medical Center. And as you heard from Dirk, but certainly worth repeating, I have the distinct honor to have local physicians who are also servant leaders and my friends. With us, we have Dr. Mashika Roberts, who is the Columbus City Health Commissioner, joined by neurologist Dr. Reversa Joseph, and yes, he is her husband, Dr. Joshua Joseph, endocrinologist from the Ohio State Wexner Medical Center. And they are the experts. So we want people, when we get to that point, to call in and to ask as many questions as you would like, because that's what today is about. It's about education and awareness. It's about making a difference in our community, especially in the African American community. Now, as a reminder, and you're going to hear this a lot throughout the conversation, if you have a question or comment for me or for one of our experts, please press *3 and leave a comment on Facebook or even Instagram. With that, we're going to have a few remarks that I am going to share with you because we think information is important. I can tell you that President Biden's leadership, he decided that he was going to have a lofty goal of getting individuals vaccinated. He went from 100 million vaccinations to 2. And I can tell you that over 3 million Americans are being vaccinated daily. But that takes a lot of servant leaders, a lot of doctors, and yes, it takes money. I am so proud that I brought over $1.3 billion back into the 3rd Congressional District to assist citizens, to give frontline workers the resources that they need, and to get teachers and students safely back in the classrooms. Now, I know many of you will have questions during this time, so don't forget to push *3. Also, please be aware that the call is being recorded and will be posted on my YouTube page at www.youtube.com/RepBeatty for individuals who were not able to participate on this call. We're also streaming the telephone town hall, and you can find it on my website or on social media pages. We're not leaving anyone out. So for all of those younger folks out there who are glued to your phones, I'm going to give you something that you can check out. Facebook.com/RepJoyceBeatty. Instagram.com/RepBeatty. Twitter.com/RepBeatty. And Beatty.house.gov. I am so pleased again to be joined, and we're going to just tell you, the Congressional Black Caucus, which I have the distinct honor of chairing, decided that we were going to run this like a campaign, so much so that we entitled it GOTV, not Get Out the Vote, but Get Out the Vaccination. And we've gone through the communities. We were at the Columbus Urban League. We kicked it off Sunday at New Salem Baptist Church. And here we are today. All week we will be talking about getting vaccinated, not just here in Columbus, Ohio, but across the United States. We have 56 members of the Congressional Black Caucus. So if you're looking to Texas or California or Philadelphia or right here in Ohio, we are testing thousands and thousands of people and giving them the vaccination. So again, if you have a question, we're going to ask you to press *3. Let me just share with you a little about what we've been doing in Washington. You've heard about money in your pockets. I can tell you I was so honored to support the American Rescue Plan that provided $1,400 checks for most individuals and their dependents. I can also tell you that I was a big supporter of the $300 in weekly emergency unemployment insurance that's not going to go just to August, but all the way until September. And let's not forget about the expanded child tax credit of $3,600 for dependents under 6 years of age and $3,000 for dependents who are over 6. We want people to be safe, we want people to be healthy, and we want to make sure that people can get back to work. And that's what the American Rescue Plan was all about, helping people get back to work by getting frontline workers the resources that they need and providing additional resources through the Paycheck Protection Plan, the Economic Injury Disaster Loan Grants, and over $28 billion for bars and restaurants to give them the money to reopen safely. We know our children need to be educated. We know how important it is to keep our children and our teachers safe back in school. That was a huge priority for me going back to Washington, so much so I went to the White House and talked to President Biden himself to share with him we need to make sure that we got the shots in the arms for all of our teachers, all of our frontline workers. And I'm so proud that the plan provided over $20 billion for the National Vaccine Program. We've been doing a lot over the last 100 days, and I can tell you I am so honored that you elected me to serve this district. And I have heard you, and I'm listening to you. And that's why we're going live. I heard you say, give us more information. I heard you say, beyond COVID-19 and the vaccination, let's stand up for justice. Let's protect our families and our children. The George Floyd Justice in Policing Act is something that I've played a big role in. It's passed the House, and we are fighting hard to pass it in the Senate and get it to the president's desk. We also know that we need to deal with redistricting. We know we need to deal with reauthorizing the Voting Rights Act. Too many initials and numbers, but just remember, H.R. 1 for the redistricting and campaigning, and H.R. 4 for the John R. Lewis Voting Rights Act. So that's a lot of information today. Enough from me, because this really is about hearing from you. So I want to make sure if you have a question, you feel free to call in. And again, as a reminder, if you have a question or a comment for me or our experts, just press *3 and leave a comment on Facebook or Instagram. With that, doctors, are you ready?
Yes.
Go.
Let's open up the phone lines.
All right, Congresswoman. Our first person live on the line with us, we have Sue joining us. Sue, welcome to the call. Go ahead with your question, please.
Yes, it's about the COVID-19. I've already had my shots, but I've been hearing, my peers and other people fearing to take the shots because they're getting misinformation from it. They're saying they're listening to other doctors that say not to take the vaccine. And so I think that's a lot of the problem why people aren't wanting to take it. Not that it's not available, but they're afraid to take it. So I was asking if there's any way that they can go step by step of what actually happens to your body when you're taking this vaccine, because a lot of people feel it's doing something to their DNA. It's changing the DNA. And then some people think there's a chip in it. So there's a lot of fear in that. And we can't conquer this unless we're all in it.
Absolutely.
So I was making that comment and also wondering what we could do as a community to try to ease people's minds on that.
Thank you so much, Sue, for that call. I'm going to let the doctors answer that. For those listening in, she wants to know, why is it safe? How is it safe? And she's actually had people say to her, that they thought it altered their DNA, or that there was a chip in it, or that it was not safe. So I'm going to ask the doctors to talk about the safety of it and talk about why we believe that you should get vaccinated.
So this is Dr. Roberts, Health Commissioner for Columbus Public Health. Thank you for that question. We heard a lot of those myths before in terms of the chip and altering your DNA. I would just remind individuals who are listening and to share this with your friends and loved ones. When you want to get good information, factual information about the vaccine, I strongly encourage you to go to reliable websites or reliable resources like the Centers for Disease Control and Prevention. Their web address is www.cdc.gov, and like the FDA, fda.gov. There are no chips in this vaccine, and I tell people all the time, if the government wanted to trace you and follow you, they would use the cell phone that most of us use every single day. I'm sure many of you are on them right now. That would be the most effective way to track individuals. The vaccine will not alter your DNA. Yes, there are 2 vaccines on the market that are made from a messenger RNA platform, but they will not alter your DNA. Your DNA is permanent. It cannot be changed by any medicine nor by any vaccine. And I would just remind individuals that we use vaccines in our nation all the time. All of us have vaccines. We've been getting them since we were children. Vaccines are safe, vaccines are effective, and the COVID-19 vaccines have been through the same clinical trials, the same safety measures, and the same testing measures that all of the other vaccines that we've had, whether it be flu, pneumonia, or chickenpox, or meningitis. All vaccines go through the same process.
Thank you.
Yes.
Would you like to add something to
Yes,
it?
I'd like to just add, another part of the question was just kind of how do the vaccines work? And I wanted to just explain briefly with the messenger RNA that Dr. Mashika Roberts was referring to with the Pfizer and Moderna vaccines. The messenger RNA, we like to describe it as kind of like a copy or a recipe that basically your body will make a copy of that, of the spike protein that's on the coronavirus. So the coronavirus, I know many of us have seen the pictures of it, and it has these little spikes around it. Well, the spike protein is what the coronavirus uses to get into our cells and to kind of wreak havoc into the cells in our body. So with the messenger RNA that the vaccines are made of, it helps your body to make a copy of that spike protein, and then your body is able to build what we call an immune response, so build up antibodies that the next time your body is maybe encountered by coronavirus, your immune system is already ready, primed to be able to attack with the antibodies the coronavirus so that you don't get very sick from it. And so that's the simple way of how the vaccines work, the messenger RNA.
And I'll just add one more piece, and that is that, another place that you can go for reputable information is your primary care provider. We're out here, we're in the communities, we serve you, we've been serving you. We only want the best for you, and we are here to help you along this journey. So if you have other questions that maybe the cdc.gov or fda.gov does not answer, although they do answer many questions on there, also talk to your primary care providers.
Great responses. Thank you so much for that. Sue, we hope you heard that. You got a lot of great information, some technical information, but also places that you can go, including your primary physician. And that's what this is all about, making sure that we give you answers from experts. Next caller, Dirk.
All right. Just a quick reminder to everybody on the line with us right now. You are listening in on a live Get Out the Vaccine telephone town hall. And if you have a question you would like to ask during this call, all you need to do is press *3 on your telephone keypad. Joining us on the line right now live is Eric. Eric, welcome to the call. You're live with Congresswoman Beatty. I'm live right now? Yes, sir. Go ahead with your question. Congresswoman Beatty, I'd like to thank you for your service to this district. I live in Columbus, I live in your district. I was proud and grateful for the opportunity to vote for you in November. I have 2 questions. As an honorably discharged U.S. Army veteran, I got those shots of Moderna for free at the VA, so I know veterans can get it for free.
free everywhere.
Very pleasantly surprised. I was expecting some inconvenient and nasty side effects. The only side effect I had was a little pain in my shoulder where the stuff's needle. And I'm wondering how common is it for people to get as lucky as I did? How common is it for people not to have inconvenient and distressing side effects?
Thank you so much, Eric, for that, and thank you for your support. I really appreciate that. So I'm just going to continue to working hard so I can keep your support. But to the audience, very good question. We hear this a lot. Side effects. What are the side effects? Side effects. Thank you, Eric, for sharing that you didn't have any major side effects, just a little sore arm. And cost. I think that is very important to let people know that it's free where you can go. Okay? You want to start with this, Dr. Joseph?
I'll be glad to, and thank you so much for that question. So about 1 out of 2 individuals has side effects. And those side effects really range, right? They range from maybe a sore arm to kind of fatigue, which many individuals can have fatigue, as well as things like, chills and maybe a fever. These are all side effects that we see with many vaccinations. They aren't unique to the COVID-19 vaccination. But it's important to know that even if you're someone who does not get those side effects, you are still going to be protected. We've seen that in study after study. When we look at the Pfizer study or we look at the Moderna study, about half of individuals had the side effects, but the majority of individuals had antibodies when we look long term. And so that's kind of point number 1. Point number 2 is that these vaccines are free. You could come right here to the Celeste Center today and get your vaccine. They're not going to ask for your credit card. They're not going to ask for Cash App or Venmo. They're going to get you the vaccine that you need. And that is the important piece. I will pass it on to my colleagues.
Would you like to add anything more, Dr. Michelle?
I think that's a wrap.
Yeah.
I think that you heard it from Dr. Joshua Joseph. It's free, and the only thing I'm going to add is drive up, vax up. Drive up, vax up. Thank you. Dirk, let's go to the next caller.
Yes, Representative. Next on the line with us, we've got Stacy joining us now. Stacy, welcome to the call. Go ahead with your question, please.
Hi, how y'all doing? And thank you guys for everything y'all doing. I'm a frontline worker as well. I just want to know, ask the doctor, what is the best COVID shot to get? I'm a frontline worker, and I'm about to return at the end of this month there, and I want to know which is the best one for high blood pressure.
Well, first of all, Stacy, let me just say thank you. Thank you for being a frontline worker, and thank you for getting vaccinated. We're going to go to Dr. Roberts.
Yeah, hi, this is Dr. Roberts. Thank you for that question, Stacy. And the good news is we have 3 very safe and effective vaccines on the market. And there's not one that is better than the other. They are all very effective at preventing COVID-19 severe infection and preventing death from COVID-19. And if you have underlying health conditions, whether it be diabetes, lung disease, or heart disease, all 3 of the vaccines will be effective for you. It really depends on if you have a preference for a 2 vaccine dose or 1 vaccine dose. And if you're comfortable with taking the limited risk, but the risk that could be involved with the Johnson & Johnson vaccine that the FDA identified a few weeks ago. But all 3 of the vaccines will be safe and effective for you, and it does not matter what your underlying health conditions are. So I would encourage you to get the vaccine that is most easily available and readily available for you when you can get it.
Thank you. And thank you so much. Is there another caller?
We've got Candace on the line with us. Candace, welcome to the call. What is your question?
Yes, I've had the 2 Pfizer shots. I'm wondering, is there going to be a 3rd shot? And when does the shot wear off? And if so, how long before it wears off?
Okay, another great question. She wants to know how long before the shots wear off, from the first shot to the 2nd shot. Okay? It looks like we're going to get it over here to Dr. Joseph, Joshua Joseph.
Yes, that's a great question. And what we know is that when you get this first shot, and this second shot, you are getting protected. That protection lasts for at least 6 months, is what we know right now. There are ongoing studies to determine in that 6 to 12 month range whether someone will require a booster shot, which is, I think, what the question was. You know, will they need a booster shot at some point? So that work is ongoing, and you will see Dr. Mashika Roberts on the TV letting you know if we need a booster shot here in the future. So we don't know the answer quite yet, but stay tuned for that answer.
Okay, Dirk, let's go to someone else.
All right, I believe we're ready for our next caller. We've got Mary joining us now. Mary, welcome to the call. You are live with Congresswoman Beatty. What is your question?
My question is, hi, this is Beatty, and I'm so proud of you, and I'm proud to have the doctors answering the question. How can we get this to the young people? Because they're saying all kind of different things about it, and they're refusing to take the shot. So how can we inform them that it's better to do it than not?
Mary, that is...
My second question is, with underlying health problems, the doctor said with diabetes, heart trouble, but with blood troubles and different things, how can you get them to understand that the shot still will be effective?
Mary, thank you so much. And that's another question that we get a lot. To the audience, Mary's first question was, how can we get more young folks out to take the vaccination? And the second question is, as we look at underlying conditions, whether that's diabetes, whether that's high blood pressure, let's talk about the effect or not, and why is it safe for us to get that. First, before I go to the doctors, I want to say to you, Mary, on Sunday, when we were over at New Salem Baptist Church, part of their drive was to get some of our young folks out. We had a family of 3, a sister and 2 brothers, who came in and said all of the things that you just said about, I don't think we want to do it, but we want to volunteer. And then they said, we think we can be a strong messenger for other young folks. So they went in there and did a photo that I'm going to be posting on my website today. Thanks to you, Mary. I just thought about this. And they are from the ages of high school at 18 up into a freshman in college. And they did a family pose with their Band-Aid and saying, go get the vaccination. So with that, who wants to take this? We're going to go to...
I'll take the first one about the youth, and then I'll let my colleagues, Dr. Joshua Joseph and Reversa, answer the next one. But in terms of the young people, absolutely, we need to get our younger adults vaccinated all the way from 16 to 30. We know that the majority of the cases we see here in Franklin County are between the ages of 20 and 29. That's also a group that usually when they get COVID-19, they have mild symptoms. And so COVID-19 is not scaring them. So Columbus Public Health is working with all of our vaccine providers, as well as many of our businesses, to see how we can motivate, incentivize, and encourage our youth to get vaccinated. Columbus Public Health did work with Nationwide Children's Hospital and Columbus City Schools. We went into the Columbus City School high schools and vaccinated kids there. So we're working. It's a slow step, but we're not going to give up because we know that's a population that we need to do. So as Mother's Day approaches, I really encourage the mothers, the aunts, the grandmothers to encourage the young people in their lives to get vaccinated to protect themselves, but also to protect their loved ones.
Okay, we're going to go over here to Dr. Joseph.
Thank you, and thank you for the question. So just touching base about the kind of the safety, I think is one of your questions about the vaccine, the safety in people that have underlying conditions. And I think what we can feel positive about is that all 3 of the vaccines went through clinical trials, no steps were missed, and the population, I mean, there were huge clinical trials of 30,000, 40,000 people. So they were studied, and many, many people of all different, having diabetes, having high blood pressure, just kind of what you would see in the general population. And so that's why we're able to say that the vaccines are safe and effective. And I think for people with hypertension, for people with diabetes, and I think if you have particular questions about if you have certain clotting disorders, of those types of things, then that's when having a good conversation with your primary care provider, your physician is going to be very helpful to kind of maybe help you decide what might be the best one to choose if you have certain specific conditions. But in general, the vaccines are saved for patients with underlying conditions.
Well, thank you for that, Dr. Joseph. And let me just repeat to the audience that all 3 of the vaccines are safe. And I think the most important thing is, as Dr. Joseph's talked about, the clinical trials. Now, I know some of you are going to say, Black and brown people have not traditionally been in clinical trials. And I would agree with that. But I think it's very important for you to know that all of us challenged those early on. I actually wrote a letter and said to them, it is so important that you up your game. You must have Black and brown people in the clinical trials. And here's another thing that I think is so important. There was a sister, a Black woman that was very engaged, a young woman, Dr. Kizzy Corbett, who was part of the scientific, the research process of making sure that we were included. We still have work to go, but we have been very much engaged in boosting the clinical trials to have more diversity in it. Okay, Dirk, that was a lot of good questions coming in, questions about the safety, questions about how do we get younger folks to be engaged, all very good questions. Dirk, do we have another question?
Most definitely, Representative, and the question comes from Chris, who's on the line with us right now. Chris, welcome to the call. Go ahead with your question. Good afternoon. My question is to the doctors regarding the COVID-19 vaccinations. I'm a COVID survivor, having survived it in May of 2020. And since May 1st of 2020, I've been tested positive 6 times in 12 months for the COVID-19 antibodies. Is it even necessary for me, as a COVID survivor and carrying the antibodies, to even worry about vaccination at this point?
Well, let me just repeat that for the audience, because I can tell you I've had individuals to call into my congressional office and ask, why do I have to wear a mask? Why do I have to get vaccinated? Because I've tested positive once, or in your case, as many as a half dozen cases. So this is the time we're going to go to the experts, and we're going to have them answer that question for you.
Well, thank you so much for that question. And the question really is, if you've had COVID-19, do you need to be vaccinated? And what we've shown over and over and over again is the answer is yes. It's like a turbocharge to the system when you get that vaccination done. And we can assure you at that point that those antibodies are going to last. And that's really what we want to do. We want to let you know that you're going to be safe and protected when you're out in the community. And so that's why we encourage individuals, even if they've had COVID-19 and they have those antibodies, to go ahead and get vaccinated.
And I just wanted to add to that, because I get this question too a lot from my patients, that they've had COVID-19, should they still get the vaccine? And like Dr. Joseph said, the answer is yes. And another way I like to explain it is that when you were exposed initially and you had the COVID-19, your body built up an immune response, but to everything that it saw from COVID-19, to everything. So it didn't build up an immunity to just one specific piece of the COVID, that was presented to the body. So your body has antibodies to a lot of different aspects of the virus. But when you get the vaccine, your body's building an immune response just to that spike protein. And so your body is able to, and the spike protein, and that's what's important, because the spike protein is what the COVID uses to get into the cells and to cause the infection in your body. So when next time it sees it, it's ready to prevent the COVID from getting into the cells. So hopefully that helps to answer your question of why you should get the vaccine, even if you've had COVID-19. Thank you.
So thank you, doctors, for that. And again, our message is we want everyone to go out and get the vaccine and get vaccinated, because it actually saves lives. Let me just share with you some data we have right here in my district in Franklin County. And it's good news, and hopefully it will help those who are wondering how many people are really doing this. Are people really getting vaccinated? Well, I can tell you in Franklin County, we have vaccinated a little over 40% of our constituents. And that means 41% have gotten the first for those who need the 2 shots, and we're almost there matching it with the second shot. A little delay because you have to wait. But we're talking about over 5 nation. And I think that's good news. So we're getting there, but we want you to be a part of helping us increase those numbers. So go get vaccinated today. Again, we're at the Celeste Center. You can come right out here off of 17th Avenue at Cleveland Avenue. And yes, it's free. And here's the really good thing. You can just drive up and vax up. Drive up and vax up. Okay, Dirk, is there another caller on the line?
Yes, Congresswoman, we have Stephen on the line with us now, joining us live with a question. Hello, Stephen. Welcome to the call. What is your question?
Congresswoman Beatty, just heard you say about the drive-up. Can I get the hours? Morning to evening, whatever the hours are. I have a daughter that works at 4 o'clock, and I need to find a location where she gets her vaccination.
Absolutely, and I'm going to let you hear that from the expert. She's part of designing this program out here, so I don't want to steal any thunder from Dr. Roberts, our city health commissioner.
Well, hello, and thank you for that question. So you can come to the Celeste Center. You particularly talked about your daughter needing to come in the evening. So on Tuesdays and Wednesdays, we have evening hours where the drive-through is open from 12:30 in the afternoon to 6:30 in the evening. Again, those are Tuesday and Wednesday. Typically at the Celeste Center, we offer the Johnson & Johnson vaccine on Tuesdays, Thursdays, and Saturdays. And we offer the Pfizer vaccine on Monday, Wednesday, and Friday. And just so everyone on the call will know about our hours, on Mondays and Thursdays and Fridays and Saturdays, we operate from 9 a.m. to 4 p.m. And on Tuesdays and Wednesdays, we operate from 12:30 to 6:30. And that's at the fairgrounds. You don't need an appointment. You can drive up and we will get you vaccinated. And everything, you just get to stay in your car, and you can bring a car full of people and we'll vaccinate everyone in the car. Or you can just come by yourself and we will vaccinate you. In addition to that, we also have vaccine availability at our health department. If you want to know about all the places you can get vaccinated, please visit us at columbus.gov/coronavirus. That's www.columbus.gov/coronavirus. Or if you want to call us, we are open 6 days a week. You can give us a call at 614-645-1519. And you can see a variety of different places we offer the vaccine. Like, for example, we're here today, but we're also going to have a team at Barnett Rec Center this evening. We start there at 12:30, and we'll be there till 7 p.m. tonight.
Well, that was a lot, and that was a great question, because I know every day people call and ask where, when, and how can I get it? And again, it is free. Dirk, do we have another caller?
Yes, ma'am. We've got Victor on the line with us now. Victor, thank you for your patience. You're live on the call. Go ahead with your question. Yes, I have a question. Do you guys have any plans, for medical bills, financial, for people that had COVID? Because I had COVID in November, went back to work, kind of stopped working in January, and seeing specialists ever since because of COVID hangovers. But is there any help to pay these bills? Because the medical community wants their money, and they're not giving up on that.
I heard that one.
I'm trying and trying.
So the question is that we have from Victor is someone who tested for COVID, and he was out of work, back to work, and I believe what he's asking about is his medical expenses. Will they be paid through a special fund or a bank of funds? Docs, any of you have, hospitals have any answers to any of that?
Thank you so much for that question. That's a really important question. And when we think about this at Ohio State, we know that there are many individuals in these situations. And what we try to do is work with individuals, whether that is a payment plan that we can work with you on, whether that is some funding that we can do for you. So I would encourage you, I don't know which health system it was, but I would encourage you to reach out to that health system and explain that situation. Explain exactly what happened, and let's see how we can work to help you through this.
Thank you, Victor. And we know that there are a lot of people out there who need to get back to work. And that's another reason that we wanted to make sure that we put money in your pockets through the stimulus to help you out with any of the hardships that you might have. But we understand that it's difficult. We are hoping, like we did in housing, for example, we helped by not letting people foreclose on their mortgages, not letting people be evicted, because we understand this has been a difficult time for us as we've worked through that. But we're going to keep looking into this, Victor. I'm reaching out to my team to see if there's anything that government, beyond the unemployment, beyond the stimulus, and that's one of the reasons that we increased the stimulus dollars, and we increased it for the dependents to make sure if there were some hardships, we could be helpful. Thank you. Next question, Dirk.
All right, Congresswoman, but before we get to the next question, I do want to remind everybody that's on the line with us and listening to this conversation that this is a live Get Out the Vaccine telephone town hall, and your questions are very important. So if you have a question you would like to ask the Congresswoman or her panel of medical experts, all you need to do is press *3 on your telephone keypad. Again, *3 to enter the question queue, just like Judy. Judy joins us now live on the line. Judy, welcome to the call. Go ahead with your question.
Thank you, Judy. Thank you, Judy, for being on. We're anxious to hear your question.
So proud of you. I'm a pastor, and I'm concerned that even though I have the COVID shot and I am vaccinated, I wear a mask. I try to be careful. I don't want to carry it to anyone else, and I do visit nursing homes, hospitals, and in church, and I don't want to hurt anybody. Is there a way that a person who's been vaccinated can carry it to someone else?
Repeat it.
Okay. So thank you, Judy, for your question. The question that Judy has asked is there a way that vaccinated people could carry the virus to someone else? So, potentially there are ways that a vaccinated person can spread the virus asymptomatically. We think that that is a very low risk for vaccinated people to spread the virus asymptomatically, but that's still why the recommendation is that, that we wear masks, if you're going to be indoors or around people that are at high risk that maybe have not had the vaccine themselves. So if you're going into nursing homes, hopefully most people in the nursing homes have been vaccinated, but if there are people that have not been vaccinated, that's why we still recommend that, you're, even with having been vaccinated, that you wear masks indoors and around other people that potentially may be at higher risk or may have not been vaccinated themselves.
Thank you so much, Pastor Judy, for that question. And that was, again, Dr. Roberta Joseph giving her that response, a neurologist and another one of our servant leaders that's been out talking to patients, working with not only her patients, but also participating in civic organizations. I want to take a moment, Dirk, and just talk about these three physicians here. Yes, they work in hospitals. Yes, they are running the entire city's public health department. But it doesn't stop there. They're here today because they wanted to make sure that they were providing expert answers. You can also see them in the community. You can also see them on Zoom, where there are thousands of people coming on, and they're imparting information and telling you why it's so important and how to get this. And that's not part of their job or their specialty. They're out here because they believe in saving lives. And they know it's so important for us to talk to all people. But sometimes those who are in inner cities or rural America don't have the same access to education and information. And that's why we're also doing this live. That's why we're also recognizing that everybody's not going to be on a Zoom, or everybody doesn't have social media. So we're still doing it the old-fashioned way. We're mailing out information. We have flyers that we're putting up in places that are open. And yes, you can also call my office at 614-220-0003. That's Congresswoman Joyce Beatty's district office. We want to make sure that we all get through this together. Next question, Dirk.
With pleasure, Representative. We've got Gertrude on the line with us. Gertrude, go ahead with your question, please.
Yes. I have two questions. One, once you take the vaccine, why are you still susceptible to possibly catching the COVID-19? And my second question is, earlier, the question was asked and it was explained that the vaccine kind of like prep your body to be ready for an infection of COVID-19. My question is, if your immune system is already prepped to receive such a thing, why do you need a vaccine? And the reason why I say that is later on, there was another question asked, and one of the doctors explained, saying that you, I think the guy asked if he had already had COVID, and he had antibodies in his body already, and he wanted to know why he had to take the vaccine. My question is, if the vaccine is there to prep your body, make sure that you have the antibodies to fight off the COVID-19, and you already had it, you already have the antibodies in your body, why do you have to take the COVID-19 shot? It sounds like that some just don't sound right to me. Because my immune system is there to prepare me for that and to fight that off. Why do I need something else to prepare my immune system?
Okay, now I'm going to give this to one of the doctors, and I'm going to make sure that we understand what the question is, because you're talking about your immune system, and is it because you believe that you've already tested positive for it, and that your immune system should be protected, that you don't have to then get the vaccine? Is that what you're saying?
No, ma'am. What I'm saying is, if you already have the COVID-19 and you already have antibodies in your system from the COVID-19, plus your immune system is there to fight off any kind of invasion
So,
of COVID-19.
okay, so
Why do I need to take a vaccine when my immune system is there to do that?
So now I think I have you. Now I think I have you, Miss Gertrude. So if you've had COVID-19, to the audience, if you've tested positive and a reliable source has said that you've had COVID-19, the caller is asking docs that she thinks, or why is it that she'd have to go get the vaccination, because is not her system already protected or immune from it, because she has had COVID-19 and obviously is well today?
Okay, so I think what you had heard earlier in response to the previous caller that had asked the question, and we had said that it is recommended that even if you have had COVID-19, that you get the vaccination even still if you've had it. And the reason that that it's still recommended if you have had COVID-19 that you still get the vaccination is because, as we tried to explain, when your body has been exposed to COVID-19, so if you had the initial infection, your body built up an immune response to everything it saw from the virus. So from the spike protein to the capsules, to everything that the virus presented to your body. Your body just tried to build an immune response to try to fight off the virus. However, it built an immune response to everything it saw. So it didn't build up to just one particular part of the virus. So it doesn't have a big immune response to just one particular part of the virus, which is the spike protein, which the virus uses to get into your body and to get into the cells in your body and to really cause a big infection within your body. So when you get the vaccine helps your body to just build an immune response to the spike protein, which is the way that the virus uses to get into your cells and to cause, the bad infection. So when you get the vaccine, your body's able to build up a huge immune response to just the spike proteins, so that the next time you're exposed to it, potentially, that your body already has those antibodies to just the spike protein, and it can help fight off the infection better than if you did not have it at all. Your body would be, if you were exposed to COVID-19, your body has some immunity, but we're saying it's not the long-lasting high immunity that you'd be able to have if you got vaccinated. So there's a difference. Yes, your body had built up some immunity because you had COVID-19, but what we're saying, you're going to get like the mega boost by getting the vaccine. Getting vaccinated helps your body build even a more immune response to just the spike protein, so that your body is better able to fight off the infection. And we know this because the clinical trials show that that the vaccination is about 95% effective in preventing you from getting very severe disease and from hospitalization and death. So that's very important.
And Dr. Roberts, you must get this question a lot, right? At the Columbus Public Health, people come in, they want to know, hey, I had COVID, do I need to get this vaccine? What are you guys telling them down there?
Yeah, so thank you for that question. And we're saying the same thing that Dr. Joseph just shared with you. When you get the natural infection from COVID-19, your body does build up some immunity, but the immunity from the natural infection is not nearly as strong as the immunity you get with the vaccine itself. And so you want that vaccine in your system to have that strong response so the next time your body is introduced or sees COVID-19. So it's very important that even though you had the natural infection, that you get vaccinated with one of the 3 vaccines we now have on the market, and you get both doses if it's a 2-dose vaccine. Don't just get the first dose and think that should be enough. You need both doses. And again, the vaccines are going to be extremely effective at preventing hospitalization and death from COVID-19. I really just want to reiterate what Dr. Joseph said about that. Could you still get a mild case of COVID-19 after the vaccine? Yes, you could. It's no different than the seasonal flu. When we all get vaccinated every year, we get the seasonal flu vaccine to prevent us from getting a severe case of the flu. Many people said, I still got the flu even though I got vaccinated. But I assure you that flu case was much milder. Your symptoms were much milder. The length of your symptoms was much shorter than had you not gotten the vaccine at all. That will be the same with the COVID-19 vaccine, and if you happen to get infected after you get the vaccine.
Thank you so much for that. And again, I'm Congresswoman Joyce Beatty, and we're here at the Celeste Center. We're asking people to drive up and get vaxxed up. It's free, and we're going to be here. Today is Monday until 4 o'clock p.m. Again, Dr. Roberts shared with us that on Monday, Thursday, Friday, and Saturday, 9 a.m. to 4 p.m. For those who work and want to come after you get off work, we are here until early evening on Tuesday and Wednesday from 12:30 to 6:30 p.m. And this is only one site that we're at. There are many sites that you can go to in your community, whether it's churches, rec centers, schools. We're just so happy that we have the vaccine distribution here in our community. Okay, Dirk, do we have another caller?
Absolutely, Congresswoman. We've got Donna now joining us on the call. Donna, welcome. Go ahead with your question, please.
Thank you. Hi, Congresswoman Joyce Beatty. My question
lose her?
Dirk, did we lose Donna?
It sounds as if we might have lost her.
Oh.
We'll see if we can get her.
Well, Donna, if you can get back on, we will put you back in the queue so we can hear your question about businesses and organizations telling people to get vaccinated. So we're anxious to hear where you were going with that question. Dirk, let's go to someone else, and we'll come back if Donna gets back online.
Absolutely. So we've got Amanda joining us now. Amanda, welcome to the call. Go ahead with your question, please.
Yes, my question is because I was a healthcare worker and working on the COVID unit, I contracted COVID. So since contracting COVID, I have been out of work due to COVID. Now I'm suffering from what you call the long haul COVID. But now every thing that you put in place for people like myself that get COVID, how come we are being denied for those benefits and not being able to get financial help?
So, Amanda, let me make sure I understand who's denying you for the financial assistance. So to the audience, Amanda has shared that she was working, she contracted COVID-19, and she's been out of work, and now she's being denied financial help. So can you share us just a little more about who denied you the financial assistance?
Exactly. I've been denied for the pandemic unemployment. They say because I'm not physically able to work because I'm still up under the doctor's care. I'm seeing almost 10 different specialists now due to COVID and still having the COVID resistance. I've been denied for rental assistance because I have no income coming in. I'm also been denied for disability, although I have a disability, but it's not sufficient enough for me to receive this disability. So now I've been out of work for almost 9 months without having any income, and my bills are getting behind, and I'm being threatened to be evicted because it's hard for me to get any financial help.
Okay.
What do you guys have in plan for people like myself?
So Amanda, let me answer that question. I'm going to say slowly our number. I'm going to ask you to call my office and ask for my social work team. I have a social worker and an outreach director, and we will work through that, but it will require a little more personal information and a release form, but we will take your case on to try to help you. Again, that is 614-220-0003. And you can ask for Sandra Jackson. She is a licensed social worker, and she'll walk you through any assistance that we can provide. Thank you, Miss Amanda. And we have, wait a minute, we have Dr. Joseph's going to weigh in for you.
So I just want to say, Amanda, this is a critical issue, and we've been seeing this in many individuals. And one of the things early on, the difficulty was that long COVID syndrome really didn't have a medical diagnostic code. So I had patients who had these symptoms over months, and they really couldn't get the help that they needed. They weren't being able to get bills paid or physical therapy paid, etc. And so 2 things have happened since that time. We now have a specific name for it called the post-acute sequela of COVID-19. And with that name, we actually are putting funding behind that. So I presented along with colleagues at the National Institutes of Health, including the NIDDK director, Dr. Griff Rogers, on the importance of doing research on this condition so that we can better understand how we can get you back to good physical health. Along with that, as Congresswoman Joyce Beatty noted, we got to get you the help you need right now, right? And I think that this diagnostic code is one of the things that's changed over the last just couple weeks that will help get the help that you need.
Thank you so much, Dr. Joshua Joseph, for that. That's another thing I want to say. They're doctors, but they also weigh in being resources to help us help you. So, Miss Amanda, thank you for that call. We'll see what we can do. Dirk, is there another caller?
Absolutely, Congresswoman. We've got Melvina
Well, Melvina, thank you for that, and thank you for your service in being a nurse. I'm going to go directly to our health commissioner on that to answer your question. At that, Dr. Roberts.
Hi, thank you for the question, Malvina. So the recommendation is clear that you should not take antipyretics prior to the COVID-19 vaccine. But you can take it if needed after the vaccine if you're having symptoms, whether it be fever or body aches. Will it lower your immune response to the vaccine? We don't know. We don't think it will lower it enough to make you need to get the vaccine again. So there is no recommendation that you get another round of vaccine because of how you treated yourself. We will wait to see about the boosters, and when boosters become available, just like we tell everyone, you should get your booster shot, whether it be from Moderna, Pfizer, or Johnson & Johnson. Really what we want to do by telling people not to pre-medicate, so prior to the vaccine, to take something like Tylenol or Advil, is so that we can see the full response from the vaccine, so that you're not blunting the response. But there's no reason to think that your vaccination was not effective because of your use of Tylenol or if others use Advil. So again, you should feel comfortable and safe that you are protected, you got your 2 doses in, and just wait like the rest of us to see if there's going to be a booster required and when.
Thank you so much, Dr. Roberts, and thank you, Melvina. And again, thank you for being a frontliner and for your services as a nurse. Dirk, let's see if we have another call.
We do have a few more callers, but I do want to go back a couple of callers. We lost Donna, and we're unable to reconnect her into this telephone town hall. But her question was this. She says a lot of people and organizations are advocating for people to be vaccinated. So Donna asks, are there any mobile units canvassing neighborhoods to educate people and vaccinate?
Well, Donna, let me just say thank you for that call, and thank you for calling back and leaving us with your question. While we have a lot of businesses and organizations who are engaged in going to stationary locations to get people vaccinated, the question is, are there mobile units that's driving around that you could get vaccinated in?
So that's a great question, and there aren't any mobile units right now, but there will be some in the future. Most of our mobile units or mobile teams are going to what we call a pop-up site. So they'll go to a site for a day and offer the vaccine. I know Columbus Public Health is doing that. That's where we'll be at Barnett Rec Center tonight. And I know that some of the other vaccine providers are doing that as well. In terms of a mobile unit, we all want to get there. We all have mobile units. And so it's just about finding the staff to allow us to do that. But we hope that in the very near future, you'll see mobile vaccine clinics around town, just like you see the ice cream truck. At least that's what I keep telling people. I'm likening it to the ice cream truck in the summertime that comes by your neighborhood, and that will be available. But I will tell you, in terms of education, that's really important. I know OSU has a team that's out in the community providing the education. I know with all the events that Congresswoman Beatty did this weekend, there were street teams that were actually going door to door, knocking on people's front door and saying, come get vaccinated. We need more of that. The city is also doing that, particularly in the neighborhoods where we're working in the rec centers. So we are providing that education in the neighborhood, trying to get the actual factual information to individuals so they can make the best decision for themselves and their family. So stay tuned about the actual mobile units. They're coming, and we know they're needed, particularly in our communities of color.
Well, let me just say, Donna, I am so glad that you called back in, and I'm so glad I got to hear Dr. Roberts equate it to the ice cream truck. So I want everybody to hear that I'm going to join in, Donna, for that push. Because earlier we had a caller that talked about younger folks. We know that summer is approaching us. And we know that although we still are masking up and keeping our, as we've done here, 6 feet apart. We're going to have young folks who are going to be outside, young folks who are going to be participating in activities. So I'm going to see what we can do at the federal level. If there's help we can give, financial resources, we need to take a look at this. So I'm putting my team on notice that this is a project that I want us to be engaged in. I can't thank you enough for asking us to make sure we get those mobile units driving through those communities where you can stop and people can come on right outside their home or their apartment, or driving through complexes and getting people vaxxed up. Thank you for that suggestion. Okay, Dirk, that was a good one. Do you have another caller for us, Dirk?
Absolutely, Congresswoman Beatty. We've got Lyle on the line with us. Lyle, thank you for your patience. You're live. Go ahead with your question.
Yeah, thank you, Congresswoman Beatty, for this town hall. My question, I am a father of two beautiful little girls, and I am really anxious to know when they will be able to get a vaccine, or if we have any data or studies coming up to indicate whether it is safe for children under the age of 15. One of them is an infant getting antibodies from her mother, but the other is 2.5, so she's just held safe by social distance, and that's it.
Okay, thank you. And I know that's a question that many of us have. I'm a grandmother, and I have 2 young grandchildren, a granddaughter and a grandson. And I was just thinking that same question. What is the age that we can do for so many of our young children? Or do they need to get the vaccination if their parents or grandparents are vaccinated? Who wants to take that question? Okay, we're going to give it over here to Reversal, who's also a mom. Let me get her the right, there we go.
Thank you for that question. And yes, I too have that concern, as I have 2 small children, 4 and actually 18 months. So I too have that concern. So currently, clinical trials are undergoing in children 12 and up, and then also some clinical trials from infants up to age 12. So looking at the Moderna and the Pfizer in these age groups to see the effectiveness and safety. But we don't currently have the data out yet to make any determinations in terms of recommendations at this point, because they're still in clinical trials. But the hope is that hopefully the fall or at some point after the fall, that those, if effective and safe, will become available, because I'm anxious for that as well. So to answer your question, currently still under clinical trials, and we do not have the data yet to make any recommendations regarding that at this time.
I would just add
Yeah,
one thing.
and so the next group, it looks like it's going to be 12 to 15. And that 12 to 15 could be as soon as June. I mean, I don't know what you're hearing, Dr. Ross.
Yeah.
I'm hearing, even as soon as June, we might have the 12 to 15 age group, and then hopefully the fall for lower age groups than that. So I think stay patient. It's coming. But until then, mask up. Continue to use the hand sanitizer. All of these protective behaviors that we've been doing. Pay close attention to the CDC website as those changes happen. And just keep ensuring that you're keeping your family safe. I know Reversa and I, she said we have 2 young kids. We're doing everything we can do to keep them safe, and I encourage you to do the same.
Well, thank you to the caller for that. It is so important that we protect our children and our families. And you got a great answer, not only because they are medical doctors, but they're also parents. Okay, Dirk, how are we looking for time? And do we have another question?
Well, we do have more questions, and I think we've got a few more minutes, so we're going to move on now to Laura, who's on the line with us. Laura, welcome to the call. Go ahead with your question, please. Hello, Laura.
Laura, are you out there? Okay, Dirk, let's go to the next caller, and we'll do the same thing we did for Donna. If Laura calls back in, we'll put her in the queue.
Yes, ma'am, absolutely. We've got Kevin on the line with us. Kevin, thank you very much for your patience. You're live on the call with Congresswoman Beatty. What's your question? not sure why I don't hear Kevin. Like we'll move on here.
Okay.
Just confirming the system very quickly.
Okay, while
Sure that
Dirk is
there's not a
checking
system
on,
issue.
while Dirk is checking on our callers, again, I want to tell you that we are live here at the Celeste Center. We're encouraging people to get vaccinated. I am so fortunate to have medical experts with us. We have Dr. Joshua Joseph, Dr. Reversa Joseph, and Dr. Mashika Roberts. All individuals who have been spending a lot of time, whether it's research, whether it's education and awareness, or seeing patients, talking about COVID-19, masking up, social distancing, and still using hand sanitizer. And I'm going to tell you, that's whether you've been vaccinated or not. It's so important for us to pay attention to this, because we want to make sure that we can get to the point where we're all seeing one another again, healthy and safely. And again, I'm Congresswoman Joyce Beatty, live from the Celeste Center. And let me just tell you, it is so exciting to be on this stage today with these medical experts as we're watching hundreds and hundreds of cars drive by. People are waving and looking at us on set. So I'm going to say to my good friend Gail King, if you're out there watching, you don't have anything on us and our staging and us talking live to the people in the 3rd Congressional District and beyond. Okay, Dirk, do we have another caller on the line? We can take one more, I believe.
Laura. We've got Laura back with us. Welcome back, Laura. Go ahead with your question, please.
Hi. My concern is with the vaccine, there's side effects. I got very sick after the flu shot, so I'm kind of scared of the corona shot. So,
Thank you, Laura. And I'm going to tell you, we get that a lot. And let me just start. I'm not a doctor. I'm just a regular person. And I got sick with the flu shot several times. I can tell you, Laura, I got the vaccinated, the first and the second shot. And other than a little sore arm here on the first shot, I didn't get sick like I did with the flu shot. So I don't think we can compare what happened to you with the flu shot with the vaccination. But I'm going to close out by letting the doctors answer that question. Okay, we're going to ask all of you that question. So we'll start with you, Dr. Roberts.
Sure. Thank you. And thanks for that question, Laura. And we get that a lot, obviously. People are concerned about the side effects. And I will just say a story that I heard from a friend of mine and a colleague, and some of you might know her, Dr. Laura S.B. Bell. And she always says, 48 hours max of not feeling good after getting the vaccine is much better than 10 days in the ICU on a ventilator. So yes, there are side effects that can come with this vaccine. As you heard from Dr. Joshua Joseph earlier, 1 in 2 individuals will have severe side effects. The other 50% won't hardly have any side effects. So you have to take that chance, but I think that chance and that risk is a much better gamble to take than the risk of getting COVID-19 and you being one of those individuals that ends up in a hospital on a ventilator.
Okay, we're going to go over here to Dr. Reversa Joseph, and we're going to let you, Dr. Joshua Joseph, close us out on that question.
Again, thank you for that question. And yes, this is a very common question. And what I'd like to say is that the most common side effects that we did see, at least in the clinical trials and just from observation from our patients, is that they would arm soreness after the injection, potentially fever. Not everybody gets that. Fatigue seems to be a common symptom, and possibly chills. But again, those side effects, if they do occur, really don't occur more than 48 hours if they are to occur. And again, like Dr. Roberts, I love that analogy. 48 hours of these, very minor side effects compared to 10 days in the ICU. I would take the 48 hours.
Well, I'll say that I had the 48 hours. I was in the bed shaking and writhing, but it's great to know that I'm protected now. And what I've seen in my clinic, I've had clinics where 40 or 50% of the people have had COVID-19. Let me repeat that. right here in Central Ohio, right here in OH District 3, I've had people where 40 to 50% of people in my clinic have had COVID-19. And so I know that this vaccine is our next step to really conquering what we know as COVID-19, and we might as well say COVID-20 and COVID-21, right? But we all know that we can get past this. And the first step in doing that is the COVID-19 vaccine. So I just encourage everyone out there to take a little bit of time, maybe take a little bit of side effects, and go ahead and get the COVID-19 vaccine as soon as you can. If you're asking which one, it's which one is in front of you, right? So that you can get it, avoid hospitalizations, avoid morbidity, and even death. We want any of that for anyone in OH3, anyone across our great state of Ohio, or anyone across our great nation. Thank you so much.
Well, what a great way for us to bring closure today. Dirk, let me first start with you and say thank you for being a great moderator. And I want to give a big thanks to the medical doctors who are here with me. Again, Dr. Mashika Roberts, Dr. Reversa Joseph, Dr. Joshua Joseph. And let me just say again, I'm Congresswoman Joyce Beatty, representing Ohio's 3rd Congressional District. Thank you for being live with us. And just as a reminder, my Washington, D.C. office number is 202 area code 225-4324. And my district office number is 614-220-0003. The office is available to answer any questions that we were not able to answer today, or anyone who didn't get able to call in or connect. Feel free to call my office and we will get a response to you. Also, you can visit my website at www.beatty.house.gov if you would like to sign up for my congressional newsletter and to receive more information about the work we're doing for the 3rd Congressional District. We need to hear from you, and if you're watching, look at all the cards who are lined up here again. And I want to give a special thank you to the Congressional Black Caucus for telling all members to make sure that they did get out the vaccination. I'm Congresswoman Joyce Beatty, and I approve this message.
Thank you very much to everyone who tuned in and had questions asked and answered during this live Get Out the Vaccine telephone town hall with Congresswoman Joyce Beatty and a panel of experts. We appreciate you taking the time for this call. We hope you stay healthy, happy, and safe, and have a fantastic day. Goodbye.
Great job. Great job.
This